First disease that we'll be talking about, well, I wouldn't say disease, it's more of a symptom or like a syndrome or just an infection or just something that may be going on with the body. This is diarrhea and constipation. Diarrhea, as I'm sure we have all know, diarrhea is a frequent loose or watery stool. It can result from an illness, dietary changes, infections, or medical conditions. And then we have constipation, which I'm sure everybody has, like diarrhea, has had a form of constipation at some point in your life. Constipation is an infrequent, difficult stool passage. This is caused by a lack of fluid intake, immobility, which is not moving around and laying around in bed, medication side effects, and underlying serious conditions. Some treatment and nursing management for diarrhea and constipation includes a general health assessment. Some medications would include bulk forming agents, some stool softeners like Metamucil. Some dietary recommendations would include to increase fiber intake, avoid gas-forming foods such as legumes, the cabbage family, onions, potatoes. Restrict milk for lactose intolerant patients. And some things you're going to want to educate the patient on is to wear loose clothing if bloating is present. And instruction on medication adherence and dietary therapy. All of these things will be important in order to help deal with constipation and help manage diarrhea. Some medications for diarrhea. So some common drugs include some diphenoxylate hydrochloride, which is Eloxamil, some loperamide, which is Idiom, some choline pectin combinations. Please excuse the way I'm pronouncing some of these medications because medications in their generic form are very difficult to read. Some actions would include to decrease fluid content, to bind water, and to coat the mucosa of the stomach. And some things that you are going to want to teach the patient is to not exceed recommended dosages of these medications. Some Pepto-Bismol can also cause black stool. So if you're taking Pepto-Bismol for diarrhea, it can cause black stool. So don't be too alarmed if you see that. Some medications to help with constipation would also include some bulk forming laxatives such as Metamucil, which is penicillium, and methacellulose, which is Citracel, which acts like a fiber which absorbs water in the bowel to enhance bowel movement. You're also going to want to take some surfactants, which this includes some docusate sodium, which is Colase. And then the action of docusate sodium is to facilitate water absorption in the stool. You're going to want to teach the patient to take with a full glass of water and not to use for a long term without the provider's knowledge. All of these things are going to be very important for medications for constipation. Contact laxatives. This is another medication that can be helped used for constipation. This includes your Bisacodral, which is your Docalax. This includes your Senna, which is Senecot, and your Cascara Sagrada, which is a herb that is commonly used as well to help with constipation. The actions of these drugs include to increase the secretion of fluid and electrolytes in the intestines. Some things that you're going to want to teach the patient. You're going to want to teach the patient that tablets should not be chewed. Swallow your tablets whole when you take them with water. Take with a full glass of water in order to help with the absorption of the medication. Some side effects for the laxative include burning rectal sensation if a suppository is included, and colored urine, which could be pink or a brownish yellow color. Next, we have IBS, which is irritable bowel syndrome. So what is irritable bowel syndrome? This is pretty much your group that includes the constipation and your diarrhea, characterized by abdominal pain, bloating, or the absence of a detectable disease. The diagnosis for IBS includes, based on clinical manifestations, ruling out organic bowel disease. Some symptoms would include abdominal pain relieved by defecation, changes in stool frequency and consistency, and mucoria, which is mucus in the stool or bloating. The definition of the irritable bowel syndrome would be a functional GI motility disorder. That's pretty much what IBS is. It's a functional GI motility disorder. It's prevalent mostly in women and a major reason for missed work days in North America. Some of the causes include a familial predisposition, stress, caffeine, sensitivity to dairy or wheat. For the pathophysiology, it includes an altered motility of small and large intestines, possibly triggered by infection, stress, or altered nerve function. So irritable bowel syndrome pretty much just includes your diarrhea and your constipation. Some treatment would include a symptomatic relief, peppermint oil for temporary pain relief, and avoid peppermint oil and GERD in patients. We're going to talk a little bit about GERD a little bit later. For nursing care, teach your patients about lifestyle changes, diet management, and stress reduction. Some medications to treat IBS would include your linaclotide, which is Linzess, and lubiprostone, which is Amitiza. I'm not too familiar with either one of those drugs. I would definitely look them up after I'm done this presentation. The actions of these drugs include to increase fluid in the intestines, reduce pain sensitivity. Some nursing considerations would include to warn against direct sunlight exposure due to photosensitivity. Patients may experience side effects including nausea, abdominal pain, diarrhea. For patient education, you would want to take these drugs on an empty stomach and report adverse effects such as shortness of breath. Very important, you want to report those things to your provider. Next, we have diverticulosis and diverticulitis. The definition of diverticulosis is a presence of a diverticula in the colon, which can be an asymptomatic situation. For diverticulitis, this is inflammation or an infection of the diverticula. Some risk factors include a low fiber diet, obesity, constipation, and aging. Some signs and symptoms, diagnoses, and treatments for diverticulitis include lower left abdominal pain, one of the major signs of diverticulitis. Lower left abdominal pain, bloating, nausea, vomiting, diarrhea, or constipation. See, when you know where things are, lower left quadrant, this is your diverticulitis, and lower right quadrant, which would be your appendix, which we'll talk about a little bit later. Some diagnoses include a CT scan with contrast. This is the preferred method. You would want to avoid a colonoscopy during acute cases. For treatment, treatment includes clear liquids, organ antibiotics, high fiber diet after recovery, and for severe cases, IV antibiotics and bowel resting. A diet for diverticular disease would include a high fiber diet, which all of these things that include high fiber is whole grains, cereal, breads, your fruits such as some apples, berries, peaches, and pears, your vegetables such as squash, broccoli, cabbage, spinach, the legume family such as the beans, the peas, the lentils, and drink plenty of fluids in order to aid with your digestion, because more fluids is going to help move your bowels past a lot easier. Some lifestyle changes include incorporate regular exercise in order to prevent constipation.